Arthritis affects nearly a quarter of Americans. With more than 100 types, it can be difficult to diagnose. It's also a leading cause of work disability in the U.S., with annual costs for medical care and lost earnings topping $300 billion. That's according to the CDC. So here with more on this is Dr. Ashira Blazer, assistant professor and academic rheumatologist at the Hospital for Special Surgery here in New York. Thank you so much for joining us. I didn't even know there were 100 different types, but I can imagine some of the symptoms are quite subtle, and so it might be difficult to determine, why you're feeling achy or stiff. So let's start with sort of the basic differences. How do rheumatoid arthritis and osteoarthritis differ?
Yeah, so rheumatoid arthritis is more of our classic autoimmune condition, meaning that instead of the immune system protecting you against viruses and bacteria, it can start to be active against your own healthy tissues. And that means that this is more of an inflammatory condition. So you have swelling of the joints, you have stiffness of the joints that can last 1 hour, 2 hours in the morning, and that can be a sign of an inflammatory response. Whereas osteoarthritis is more of a degenerative process, meaning as we all age, we use the large joints of our lower legs, we use our hands, maybe the part of the thumb here, and those joints can start to be damaged from everyday wear and tear. And so this is the kind of arthritis that creaks and pops when you try to walk. It's worse with movement, things like that. This is the arthritis we see with age.
So I imagine that once arthritis starts to kick in, there can be sort of a domino effect with your health because you're not moving as much, so on and so forth. So what are some of the complications that can arise from an arthritis diagnosis?
Absolutely. So the first thing is when you hurt, you don't want to move. And that can be a problem for both kinds of arthritis because we really rely on the support structures, the muscles, the ligaments around the joints to protect joints that have been damaged. And so we can see that as people get arthritis, it can worsen over time, especially if they're not doing things like physical therapy. The other thing that we worry about, particularly with rheumatoid arthritis, is that if someone has this systemic inflammation that's not well controlled with medications, it can affect other parts of the body. So we see patients with rheumatoid arthritis start to develop heart disease earlier in life than other people.
Wow, you wouldn't even think that. So then it's really important to get a diagnosis as early as possible. Why can a diagnosis be so challenging?
It can be very challenging because sometimes people don't know why they're aching, right? Osteoarthritis is something that kind of gradually comes on. Rheumatoid arthritis can come on a little bit more quickly, but you wake up in the morning, all of a sudden you have stiffness. You're not really sure if this is caused by arthritis or if this is just everyday aches and pains.
Right.
And so it really takes thinking about it and then going to see your doctor to try and get a diagnosis.
Yeah, I think there's this feeling generally that this is just what happens as you get old. Your joints ache and you sort of have to accept it as like sort of one of the side effects of aging. But how important is early detection and treatment?
It's extremely important, extremely important. With rheumatoid arthritis, especially because I think all of rheumatologists used to see people come in with very damaged joints, with hands that weren't working anymore. And that's because people didn't have the option of getting on these disease modifying medications. But now we have so many options for decreasing the inflammation of arthritis and decreasing the joint damage caused by arthritis. And so we can see people live very well and healthfully into old age with rheumatoid arthritis and still have that functionality. But diagnosing early is really key for that.
Really good advice. Dr. Ashira Blazer, thank you very much.